If you're struggling with how to give a report and you don't know what to say or how to include it, this video is gonna be perfect for you. Hi everyone, welcome back to my channel. Today we're gonna be talking about how to give a strong report. I'll be sharing with you key things to remember about giving a report. I'll be giving you a step-by-step breakdown of what to include in your report. And by the end of this video, we're gonna put it all together. And I'm basically gonna be giving a report to you with fake patient information, but it's gonna help you really put together how you can give a strong report. So without further ado, let's jump right in. All right, so key thing to remember is to break up report into 5 major parts. First is just painting a history of the patient. Second, you'll do your review of systems, the head to toe. Third, any updates about that patient that didn't fit into the review systems. 4, any test results or lab results. And then 5, anything that's pending for them. All right, so now let's go into how to actually give report. We're going to be going over the information that you want to include and the order in which you want to include it. The very first thing you need to do is paint a history of that patient. It gives the nurse a basic overview of who she's getting. Start with their name, age, and room number. Safety comes first. You gotta make sure that you and the person you're giving a report to are talking about the same patient. Because trust me, sometimes you aren't. 2, what's their admitting diagnosis and when were they admitted? 3, what's their living situation? Do they have any core measures? And what's their ambulatory status? Are they living at home with a caregiver or a spouse? Core measures depend on your hospital. And how do they walk? Do they use a walker or they're fully independent? 4, what's their code status? Are they full code, DNR? Are they in any isolation? Any allergies? 5, which doctors are on board? Who's the attending doctor? And are there any consults? 6, include their important history. You can leave out information that is completely irrelevant. Let's say you have a 97-year-old woman who had a hysterectomy 50 years ago. That's not really important information that you need to include. And if you're a new nurse, you may definitely be overwhelmed by the long list of history that your patient may have, but over time, you'll kind of figure out what needs to be included and the things that you can leave out and leave for the next nurse to just review on their own time. Now that we've laid a foundation of the patient's history, we can go ahead and go into the head to toe. Start with neurostatus. What orientation level are they? Are they alert oriented times 1, 2, 3, 4? Are they confused, forgetful? And then here I like to include sensory information that could affect how we're able to communicate with that patient. So are they hard of hearing? Are they blind on one side? Do they speak only a certain language? And then I like to mention pain as well. Are they complaining of pain? If so, where? And what are we giving for pain? Next, cardiac. So do they have a telemetry? If so, what's their heart rhythm? Are they having any issues with blood pressure or heart rate? Then we can go into central lines, IVs, and dialysis sites. Next, what's the respiratory status? Are they using oxygen? Do they have oxygen at home? What is their O2 stat if they are on oxygen? Are they having crackles or wheezing? Do they have any breathing treatments? Are they getting any Lasix to kind of get that fluid out of the lungs? Then we can move on to GI status. So when was their last bowel movement? Are they having constipation or nausea or vomiting or diarrhea? Are we giving any medications for that? Do they need help feeding? How much of their meals are they eating? Are they eating just 10% of their meals? They may need a nutrition consult. Do they have an NG tube or do they have a PEG tube? If so, what are their feedings? Next is a urinary system. So are they voiding? If they're a dialysis patient, they may not void, so you want to include that they're anuric. Do they have a Foley? If yes, when was that Foley inserted and did we send urine cultures? Is the patient incontinent? Are they having any abnormal elimination like bloody stools, really hard stools, or bloody urine? Something to take note of. Next is the musculoskeletal status. So what's their baseline mobility? Do they use assistive devices? Do they need help getting out of bed? A 1-person or 2-person assist? Do they have an amputation? Is there physical therapy on board? And do they have any restraint? Next, we want to talk about VTE. So what are they using to prevent clots? Do they have an SCD order or heparin or Lovenox? Next, do they have any skin issues? Any rashes, any redness, pressure ulcers, open wounds? If there are wounds, is there a wound care nurse on board? Are there wound care orders for the floor nurse to carry out? When's the last time that dressing was changed? What does it look like? All that information. Next, I'll add in any information that didn't fit into the review systems. For example, here's what I would say: that the patient had a fever of 102.1 last night, so we gave Tylenol, and then since then it's been normal. So the next section, you want to talk about test results. So any important labs, and then images. Labs can include your electrolytes, your CBC, blood cultures, just anything that has to do with what that patient's in for, or anything that's abnormal. So then for imaging results, you want to include your chest x-rays, your CAT scans, MRIs, ultrasounds, and if you can, why they had those tests performed. And then also in test results, I like to include any surgeries that have happened, and also if there's any like biopsy results pending from a surgery. Alright, so the last part of the report is to include any pending information. For example, plans for dialysis during your shift, and that the patient still needs to sign their consent. Just stuff like that that really shouldn't be left out. And then I finish by asking if the nurse has any questions. So I know that seemed like a lot of information, but it's actually much quicker if you just run through it. So let's go ahead and jump into our real patient example of what given report looks like. So I'm actually reading off of a report sheet. I just wrote out some stuff. So if you see me looking down, that is why. But here we go. So this is patient in 552. This is Mark Van. He's a 42-year-old male admitted on February 2nd due to pneumonia. He was complaining of cough and wheezing for about a week and shortness of breath. So that's what brought him in. He is from home. He lives with his wife. His core measure is CHF and pneumonia, and he is a fall risk, and he is fully independent. He's a full code, no isolations, and no allergies. Attending is Dr. Donald. For consults, he has Dr. Libra for nephro. He has a history of BPH, CHF, CAD, diabetes, hypertension, and end-stage renal disease. His dialysis days are Monday, Wednesday, Friday. He is alert-oriented ×4. He complains of a dull chest pain when he coughs, so I'm giving him Tylenol every 6 hours, and then he also has cough medicine that he says has been helping a lot. He does have tele, he's normal sinus rhythm, and occasionally goes up to sinus tachy when coughing. He has a left AC 20 gauge, and his dialysis site is a right AV fistula. He is currently on room air, but occasionally when he has trouble breathing, we put him on 2 liters. His O2 sat has been stable. It's been 93 to 96%. He does not have any home O2. His last bowel movement was February 1st, a day before he came in. He said that he had some diarrhea, but I haven't seen any during my shift. He is on a renal diet. He's eating 75% of his meals. He still voids a little bit, so he's oliguric, and he uses a urinal at bedside. For VTE, he gets heparin. His baseline is fully ambulatory and independent. Occasionally, he needs a one-person assist if he's feeling really weak getting out of bed. There are no restraints, no PT or OT, and there are no skin issues noted. So during my shift, his blood pressure was 180/95, so I did give a PRN dose of hydralazine. Since then, his blood pressure has been stable, staying around the 130s to 140s. He had dialysis yesterday, and today his labs are pretty much normal. His sodium is 135, potassium 5.1. His chest x-ray on admission showed patchy infiltrates. He had a repeat chest x-ray earlier today. It's showing improved pneumonia. Blood cultures were sent. So pending for this patient is he's gonna have dialysis today, consents are signed, and there's an order for a repeat chest x-ray. They'll probably do that after he gets dialysis. Also, I heard on his chest that he's a little bit crackly, so could you please follow up on possibly getting a diuretic on board? And yes, any questions for me? And ta-da! Much easier than it looks. I know it's a lot of information, but the more you try to give report in a systematic way, the easier it becomes, and you'll just be going over step by step without jumping from this place and this place and this place trying to put everything together. But I hope that what I went over today is going to help you take away some key things that are going to help you give a great report going on to your next shift. Thank you all so much for watching this video. I will see you guys next time.